Hello, everyone. So we'll just take a minute or so to allow people to enter the room for our webinar. This is our second masterclass of the Primary Care Masterclass in Sport and Exercise Medicine and Musculoskeletal Health. I want to thank Western Department of Family Medicine as well as Fowler Kennedy for supporting this masterclass series that we get to hear from in total over a dozen international speakers and this is really guided by primary care physicians. So Canadian family doctors, what they want to know about sport and exercise medicine and musculoskeletal health. So we'll just give another minute or so for people to come in, and then we will get started. Okay, so we'll get started now. So I'm Dr. Jane Thornton. Nice to see everyone again. Thanks to all those that attended the first masterclass. A great turnout from all around the world with over 200 registrants, and really thrilled to have everyone give such enthusiastic support in our series so far. I'm really honored to be able to introduce Professor Saverio Stranges today, and we'll get to that in just a moment. I just wanted to start off with a couple of housekeeping and announcements, but first and foremost to say hello and to say our land acknowledgement, which is what we do here in Canada. We acknowledge this is sacred land upon which we are privileged to live and work. We recognize the deep and long-standing connection and relationship between Indigenous peoples and the land of Southwest Ontario and of London, which is where we are. We acknowledge the Anishinaabe, Haudenosaunee, Lenapehouk, and Chinongton nations whose traditional lands we are gathered upon today, and we're deeply grateful to have the opportunity to be in this place. So with that in mind, I'd like to mention a few housekeeping items. First of all, we've turned off the chat and we'll be using the Q&A today. And the session is being recorded, and the introduction will be followed by a 40-minute presentation, then about 15 minutes of question and answer. And one of the things we noticed in our first masterclass is there's a lot of questions. It was great, but to get through them all, we'll try to use the upvoting feature, which means that if you find another question that somebody's asked that you like and you think that should be prioritized, you can click on it to say that you like it, and it'll get prioritized in the system. So I'll be moderating the Q&A, and I'll take a close look at that to make sure that we're answering all and asking all the pertinent questions of our guest today. This masterclass was developed with input from our scientific planning committee. So thanks to Dr. Eric Wong and Dr. Sadia Jan. And I have the pleasure of introducing our speaker today. Professor Saverio Stranges is currently professor and chair of the Department of Epidemiology and Biostatistics within the Schulich School of Medicine and Dentistry at Western University here in London, Ontario, Canada. He holds a cross appointment as professor in the Department of Family Medicine as well. Dr. Stranges is a medical doctor, public health specialist, and chronic disease epidemiologist with extensive experience in the field of epidemiology and public health research. His research focuses on the epidemiology and prevention of chronic disease and aging, specifically regarding the role of lifestyle, nutritional, and psychosocial factors, such as dietary patterns, sleep behaviors, and social determinants of health. He's also interested in global health, especially in the area of cardiometabolic disease and low resource settings, as well as an interdisciplinary in research. So we're thrilled to have you, Saverio. Thank you so much. I've learned so much from you over the years anyway, and so it's a privilege to be able to share your knowledge, your wisdom, your pearls to the rest of our primary care physician community, as well as the international sport and exercise medicine community. So thanks, and the floor is yours.
Thank you very much, Jane, and welcome to our colleagues from Canada, and also I understand there are colleagues from outside Canada as well. And so that's great that we can reach people also outside our local community. So I will be talking about the relationship between sleep and physical activity, and also how to provide advice. And this is based on my experience, both as a scientist working in this area, as well as a public health physician. My previous lives in my home country, Italy, as well as in England, I also work as a primary care doctor, so I can bring, I guess, both a public health perspective, but also a primary care perspective. These are disclosure of financial support as far as the overall masterclass, my statement for potential biases. In terms of my financial support, some of this work has been funded by the Canadian Institute of Health Research, as well as by internal funding here at Western and Lawson Internal Research Fund. And I also acknowledge collaborations with some international organizations, including the WHO, the INDEP network, for the work we have done in low-income countries, and many colleagues I will acknowledge as well at the end of my talk. So the focus of the presentation really will be on the role of sleep in health across the lifespan, trying to convey both a primary care and public health perspective, as I mentioned before. And more specifically, we will discuss about the role of sleep health across the lifespan, the epidemiological trends in terms of sleep problems. We'll focus on the relationship between sleep and physical activity. I will provide some of our research findings on the relationship between sleep and chronic disease risk. And we will conclude the talk with some clinical and public health implications, recommendations, as well as takeaways for primary care. So hopefully by the end of this session, participants will be able to advise patients on the relationship between sleep and physical activity. Just to put things in the broader context, obviously, I'm Italian myself. We like to look at what the Greeks used to teach us, and Hippocrates was one of the first physicians highlighting the importance of sleep. So in whatever disease sleep is laborious, he will say some years ago, it's a deadly symptom, but if sleep does good, it's not deadly. Just to convey the message that sleep has been actually in the radar of medicine for a long time, also because we are supposed to spend 1/3 of our lives sleeping if we are able to meet current guidelines, which are around 7-9 hours per day among adults. And obviously, we know that sleep physiology and sleep needs change over time across our lifespan, from childhood all the way to older adults. And it's also important to acknowledge that our sleep habits are influenced by different levels of factors. In the biomedical field, we often focus on individual level factors, genetic factors, our behaviors, physiology, psychology, but obviously there are influences also at the societal level in terms of where we live, also in terms of societal factors like, for example, racism or discrimination, the natural environment, and the social level factors like the neighborhood where we live will have also an impact on our sleep habits. So over the last, I will say, 10 years, there has been an increasing interest also in terms of the research we do on looking at these multi-level influences at the neighborhood level, in particular, in terms of the environmental factors which may impact our sleep habits. I'm talking about, the ambient, the noise, the light, air pollution, but also in terms of the social conditions where people live, in terms of socioeconomic status, race, ethnicity, immigration status, the built and social environment, walkability, social cohesion, safety, violence, crowding, and so on. So all these environmental influences will have an impact on the way we live our lives, including our sleep habits. And so I think it's important also in terms of the research we do to acknowledge these different influences. Now, from a public health perspective, there has been increasing attention from many organizations around the world on the increasing prevalence of insufficient sleep or sleep deprivation in many countries and population subgroups. For example, the Institute of Medicine in the US addressed sleep disorders and sleep deprivation as an unmet public health problem, and this was some years ago. Center for Disease Control in the US also talk of insufficient sleep as a public health epidemic, and this was before the COVID pandemic. And obviously, there are concerns also in terms of the societal impact of sleep in terms of the economy, because obviously sleep problems will have an impact in terms of, for example, absenteeism, in terms of work productivity, in terms of related diseases which may require medical attention, including hospitalization. So there is a large financial burden driven by insufficient sleep, which has been estimated, for example, in this comparative analysis, focusing on high-income countries, including Canada, trying to estimate direct, indirect impact of sleep problems in terms of economic burden. And you know, we do research in chronic disease epidemiology. I can witness that sleep has become a kind of additional behavioral risk factors that has been gaining momentum over the last 20 years. And if you look at the hits in PubMed around sleep, you see that there has been an increasing number of publications over the last 2 decades. So sleep is becoming a hot topic in chronic disease epidemiology. In terms of the global trends, we tend to assume that sleep problems are only a problem of high-income countries, and actually there is also growing evidence on the public health burden of sleep problems in low and middle-income countries. For example, this was a study we did with WHO some years ago when I was at the University of Warwick in UK, across 8 different countries, where we reported that 1/3 of older adults, these were people over the age of 50, will experience sleep problems in those countries. And the other interesting finding, which is consistent also with evidence coming from high-income countries, it seems that females are more likely to report sleep problems as compared to males. And this is, as I mentioned, a consistent observation also in epidemiological studies coming from high-income countries. What is concerning from a public health perspective is that duration of sleep seems to be declining in many countries. For example, these are figures from the American National Sleep Foundation showing that possibly in the last century, in the US, people have lost on average close to 2 hours of sleep, which is concerning. And if we look at the data from Canada, for example, these are Canadian data from the Public Health Agency of Canada, we see that a large percentage of adults will not meet current recommendations in terms of the suggested hours of sleep. We should get 7-9 hours between 18 and 64 years of age, or 7-8 hours for 65 plus. And you will see that a relatively large segment of population will not meet those guidelines. And the same will apply also when we look at sleep quality. So there is close to 50% of people in Canada who will report having trouble going to sleep or staying asleep. We did a study some years ago with colleagues from Statistics Canada using Canadian National Population Health Survey data, which is a longitudinal study with at least 5 waves of data also around sleep. And again, we observe only in the space of, in the time of 10 years, consistent declining trends in duration of sleep across 4 different categories of sleep that we classified as long sleepers, high normal, low normal, or short sleepers. And again, there was a consistent declining trend in a relatively short time window. And more recently, with colleagues from my department, we used data from the Canadian Community Health Survey among Canadian adults, again, to look at both sleep duration and sleep quality. And we found close to 50% of people not meeting the recommended sleep duration guidelines, again, with higher percentage of females. And also we found a strong association with other unhealthy lifestyle behaviors, which is consistent with data coming from other countries as well. For example, binge drinking and smoking are consistently associated with increased risk of sleep problems. On the other hand, increased fruit and vegetable consumption as an overall measure of quality of diet is associated with a lower risk of sleep problems. So overall, there is a high prevalence sleep problems among Canadians, and sleep problems tend to cluster with unhealthy lifestyle behaviors, which is also consistent with other data from other countries. And also, we did a similar analysis looking at older adults in the framework of the Canadian Longitudinal Study on Aging, which is an ongoing nationwide study in Canada in people over the age of 45, where again, we found that heavy and frequent smoking as well as alcohol use was associated with both insomnia symptoms and sleep dissatisfaction among older adults in Canada. So again, when we assess also in primary care behavioral risk factors, we need to keep in mind that these unhealthy lifestyles tend to cluster together, and therefore someone having poor dietary patterns, poor physical activity patterns likely may have also poor sleep patterns as well. And also we look at the socio-demographic factors which may be associated with poor sleep. So this was a study funded by the Canadian Institute of Health Research on the social determinants of poor sleep, where basically we found that females, widowed, divorced people, unemployed people, and some ethnic racial groups will have a higher chance of poor sleep. On the other hand, older age groups, people in higher household income, higher education, homeowners will have a less chance of poor sleep, which again reiterates the notion that there is also a social gradient in terms of sleep habits, and therefore sleep disparities exist also within the Canadian population. Now, the second section of my presentation is around the close association between exercise and sleep. And this again has been the focus of investigations, I will say, over the last 10 years. Most of the field I think even in sport medicine traditionally has been looking at sleep from a clinical perspective, looking at things like clinical sleep insomnia or sleep apnea, other clinical disorders. But again, I think it's important also to look at sleep as a behavioral potential behavioral risk factor for poor sleep. And there is evidence of bidirectional associations whereby people who undertake regular physical activity, physical exercise, seems to have better sleep habits, and vice versa. People with poor sleep habits may also have a less physical activity pattern. So there is a clear bidirectional association, which is important to acknowledge when we look at these two behaviors. The good news from a Canadian perspective is that in the most recent Canadian 24-hour movement guidelines for adults aged 18-64 years, there was an acknowledgement that sleep should be part of a healthy 24 hours routine, including physical activity and sedentary behavior. So again, this to me conveys the message sleep is gaining momentum, also in terms of clinical and public health recommendations, and there is a wide acknowledgement of the close interrelationships between sleep, physical activity, and sedentary behaviors. So there is also evidence on the importance of sleep health in terms of athletic performance. I know there are many people in the audience who are interested in sport medicine, and they deal with athletes. So I think it's important to incorporate sleep health in the assessment of athletic performance alongside diet and obviously physical exercise, sedentary behaviors, and general physical and psychological well-being. There is growing evidence also on the importance of keeping natural circadian rhythms as a new frontier in athletic performance. And there has been also, studies. There have been studies looking at potential mechanisms why it's important to keep a natural circadian rhythm in terms of sleep-wake cycle on the performance of athletes. So I think again there is a momentum here around the importance of sleep in the overall performance of athletes. One question is around the timing of physical exercise in relation to sleep. So whether the timing may be may influence also our quality of sleep. Now, if we look at the most recent systematic reviews, for example, this was a systematic review by Jan Janssen and Jean-Philippe Chapeau at the University of Ottawa, looking at timing of physical activity within the 24 hours day and its influence on health, including sleep health. There was really no consistent evidence that physical activity at one time of the day will provide more beneficial health effects than physical activity at different time of the day. And other studies have also suggested that neither exercise intensity or timing seems to have a consistent effect on sleep quality among trained individuals. However, for most people, moderate intensity exercise does not have a detrimental effect on sleep as long as it stops at least 90 minutes before bedtime, which will allow for endorphin levels and core body temperature to return to levels that are favorable to sleep. So that's the general recommendation, that we should avoid moderate intensity physical exercise around 90 minutes before bedtime, based on the available epidemiological evidence. There is also increasing data on the importance of sleep habits in terms of injury risk, and whereby poor sleep or sleep deprivation may substantially increase the risk of musculoskeletal pain and sport injuries. So for those of you who are dealing with a prevention of injury among athletes, also in the general public, I think it's important also to investigate sleep habits, because they will be potentially modifiable risk factors to mitigate the risk of injuries. Now, why we need to look at sleep also in relation to chronic disease? Because there has been overwhelming evidence over the last 20 years on the potential role of sleep problems in a wide range of chronic disease. So, for example, poor sleep may increase the risk of cardiometabolic risk factors or disease. I will show some of our own research. May increase the risk of cancer, mental disorders, multimorbidity, neurodegenerative disease, and cognitive decline, and also may have an impact on life expectancy by increased risk of mortality. In the cardiovascular field, there has been a big push to include poor sleep also in the assessment of cardiometabolic health. And so there is this idea that poor sleep may represent emerging risk factor for cardiovascular disease. And indeed, there are also biological mechanisms to corroborate plausibility of these associations in terms of, for example, inflammatory processes, because sleep deprivation may increase systemic inflammation, may have an impact on our immune system, may stimulate stress hormones like cortisol, which in turn may, for example, have an impact also on glucose metabolism. And so there is an overall increasing emphasis on the importance of sleep duration and quality in terms of cardiometabolic health. And in fact, just a few months ago, the American Heart Association, this was in June 2022, the American Heart Association decided to include sleep also to the list of cardiovascular health behavioral risk factors, alongside with smoking, cholesterol, body mass index, blood glucose, diet, physical activity, and smoking. So those were the life essential 7 behavioral risk factors that we need to consider for cardiovascular health assessment. Now they will include sleep as well. So we have done a number of studies in the field, for example, looking at the association of short sleep duration and risk of hypertension. This was a study done in UK from the Wild second study, where we found an increased risk of incident hypertension. This was a prospective study among women sleeping less than 5 hours per day. And we found similar associations in the US. This was the Western New York Health Study, where again, short sleepers among females will have an increased risk of hypertension. There was no association among males. And actually, the evidence of potential sex differences in the detrimental impact of sleep deprivation, cardiometabolic health, suggesting females may be more vulnerable, is actually quite consistent also with findings from studies coming from different settings as well. This was a more recent studies where we look at the potential influence of sleep disturbances on age at onset, long-term incidence of major cardiovascular disease, and this was within an Italian prospective studies. And our suggestion would be that a short questionnaire, even in primary care, may help detecting sleep disturbance at early stage, so that we can also potentially mitigate the risk of cardiovascular disease given this link. There is also overwhelming epidemiological evidence on the association of sleep deprivation with obesity risk. And actually, this is likely to be bidirectional, because we also know that people with excess body weight may have disrupted sleep patterns. Obviously, sleep apnea, as you are aware, is a condition particularly prevalent among obese individuals. And there are a number of potential mechanisms to justify the association of sleep deprivation with obesity risk in terms of impact on leptin, ghrelin hormones, so with increased hunger, increased opportunity to eat if you face sleep deprivation, altered thermoregulation, increased fatigue. So all these mechanisms will induce increased caloric intake on one end, also reduce energy expenditure, which will eventually lead to obesity. There is also epidemiological evidence on sleep deprivation as a potential risk factor for the occurrence of type 2 diabetes. These were two studies we did, one in US, looking at short sleep duration and risk of impaired fasting glucose within the Western New York Health Study in Buffalo area, and more recently with colleagues from Luxembourg. We actually used both objective and subjective sleep measure in relation to hemoglobin A1C and insulin sensitivity in the general population. And again, we found consistent evidence that both short duration of sleep, objective and subjective short duration of sleep, will have a negative impact in terms of hemoglobin A1C and diabetes risk. There have been also a number of studies suggesting that sleep problems may reduce survival or life expectancy. This was a study we did in South Africa on the occurrence of sleep problems and potential impact on risk of mortality. And this is again consistent with a large number of evidence suggesting that poor sleep may indeed increase risk of mortality. I was mentioning about important sleep across the lifespan, because as you are aware, sleep problems may actually impact health outcomes from very early stage in life all the way across adulthood. And one particular domain is also mental well-being. So these are two studies we did with our colleagues here at Western University in our department in family medicine as well, with Dr. Graham Reed, and psychiatry with Dr. Giuseppe Guaiana, where basically we found that sleep problem may increase the risk of depressive symptoms, anxiety among early adolescents, as well as reduce psychological well-being among older adults from the Canadian longitudinal study on aging. So the impact of sleep problems seems to be consistent in terms of mental well-being across different age groups. And one area of concern is obviously the reliance or the abuse of social media use and electronic devices, mobile phones, and so on. There is overwhelming epidemiological evidence linking excessive social media use with poor sleep quality and negative mental health in youth. This was a systematic review we did with a focus on youth and university students, but there is evidence also among adults. I think there is a consistent pattern in our generation of people using mobile phones, electronic devices in bed, which obviously will have an impact on our sleep, quality of sleep and duration of sleep as well. As we are in the era, I will say, of multimorbidity, chronic disease do not occur in isolation. So it's important also to look at the simultaneous presence of multiple chronic disease, which is the definition of multimorbidity. Very recently, we also look at the impact of poor sleep habits in terms of risk of multimorbidity, again, within the Canadian longitudinal study on aging. And we found strong associations with both short or long duration of sleep and dissatisfaction with the sleep quality in terms of risk of multimorbidity. We use two different definitions for multimorbidity. The public health definition will consider multimorbidity as the occurrence in the same individuals of at least 2 chronic conditions from a list of 9 major chronic disease, which will have an impact on mortality or morbidity at the population level. And there is a primary care definition, which I think is more relevant to the audience, which defines multimorbidity as 2 or more chronic conditions from a wider list of relatively also mild conditions, which are, however, quite common in primary care, and you can see the list there. And finally, in terms of chronic outcomes, there has been also a lot of research looking at poor sleep patterns, sleep problems, and risk of cognitive decline and risk of dementia. There is very much a strong association. And in fact, sleep is one of the components of multi-domain interventions, so lifestyle interventions amongst people with mild cognitive impairment in terms of reducing the risk of dementia. There is also wide research and around the impact of shift work on health outcomes. And this was a study we did with one of our graduate students recently, again using data from the Canadian longitudinal study on aging, on the potential impact of shift work on cognitive performance. And we actually found in this population of older adults that shift work was significantly associated with a poorer performance for executive functioning. And obviously this is concerning because shift work may also potentially increase risk of cognitive decline. And there is, a lot of research, even in terms of the potential mechanism whereby shift work will induce circadian misalignment, and this circadian misalignment may again lead to potential risk of different chronic diseases. So I think this is a very important area of research, also with implications in terms of workplace routine and also policies around workplace shift work. In terms of the biological mechanism, why sleep disturbances may, for example, impact aging and through inflammation, for example. Inflammation seems to be one of the key mechanisms to induce a range of chronic diseases, including neurodegenerative disease or cognitive decline. Obviously, in epidemiology, when we try to assess an association between potential risk factor or behaviors in relation to chronic disease, we also need to consider whether sleep may actually be a risk marker, and therefore we need to look at potential mechanism or also rule out that there may be confounding factors which explain this association. So in some studies, we also try to identify who are the short sleepers in our population. So it's important also to look at the socio-demographic profiles of individuals, also the places where they live, because again, that may have an impact also on the risk of a chronic disease. So I think there is a strong evidence that poor sleep is a risk factor for chronic disease, but I think we need to also continue investigating other factors which may explain some of these associations. So I'm coming to the last part of my talk. So what are the current challenges and open questions in the field? So, as I said before, traditionally, the biomedical focus on sleep has been very much on clinical diagnosis of sleep disorders. There are, many different clinical disorders. The most common, clinical insomnia or sleep apnea, restless leg syndrome. Obviously, sleep problems are often comorbid with the psychiatric illness. And I think it's important to distinguish between those clinical diagnoses and behavioral sleep problems, which actually are very prevalent amongst all of us. So it's important also when we try to investigate sleep problems to rule out potential underlying conditions which will increase the risk of sleep problems. We need to acknowledge there is a likely bidirectional relationships, for example, sleep and obesity, sleep problems and depressive symptoms. We need to also investigate the multi-level influence, not just at the individual level, but also the social and the societal level factors. So even in primary care, when we deal with people or patients with sleep problems, I think we need to make efforts also to investigate the social profile of those individuals, because that may also have an impact on their sleep habits. It is important also to carry out additional more physiological study to understand some of the biological mechanisms whereby poor sleep may lead to a chronic disease, for example. And both in terms of research and clinical practice, obviously there is this issue around the measure of sleep, because most of the epidemiological studies have relied on self-reported information based on self-report from our study participants. But obviously there is an increasing now reliance on objective measures like wrist actigraphy or polysomnography, which, however, are not always feasible for large population-based studies. So the sleep assessment issue obviously is an ongoing question, which measure we should use in research or in clinical practice. And the two approaches are actually not mutually exclusive, because they may convey different information. But in terms of population-based studies, most of the studies we have are based on self-reporting information from questionnaires, and there are a number of validated questionnaires which can be used in population-based studies. But obviously, we will need to account for potential misclassification or recall bias. On the other hand, we could use objective measures, especially in clinical samples or in relatively small population-based studies using, for example, wrist actigraphy. And also it's important to look at changing sleep patterns over time, because obviously sleep habits, as many other behaviors, will fluctuate across the lifespan. At the moment, we do not really have biomarkers, direct biomarkers of sleep habits. Obviously, we have biomarkers in terms of the potential, for example, hormonal responses or inflammatory responses, which may be induced by poor sleep habits. So sometimes, I'm asked, shall we use objective measure? Shall we use subjective measure in our studies? Again, the two measure not necessarily a replacement for each other, but they can be used in combination, because they will collect information which can be used complementarily. And for example, here I'm showing the sleep quality assessment Pittsburgh Sleep Index questionnaire, which has been widely used in population-based studies. In the some of the studies we have done more recently, we have used wrist actigraphy. But again, we try to use both information, because that will be important in assessing overall sleep health of our study participants. So what are the clinical and public health implications of sleep problems? So obviously there is concern about the high prevalence of sleep problems in current societies, both in high income and low middle income countries. We can say that everybody is exposed, which is not necessarily the case for other behavioral risk factors. If we think, for example, smoking has been the risk of smoking has been attenuated because of policy aiming at smoking cessation or smoking bans in public settings. I don't think in terms of public health campaigns, there is still a large emphasis on the importance of promoting sleep health in the general population. There is also a large burden of accidents caused by excessive sleepiness. Also, accident in terms of medical errors, which can be induced by excessive sleepiness. Potential increased burden of several chronic disease, as we have showed that poor sleep may increase the risk of a number of chronic disease. There is an economic burden in terms of healthcare and society. And it's amazing that there is still little attention to sleep in clinical training and practice. I think for most physicians, we will feel uncomfortable providing recommendations around sleep because we have not been overly exposed to, sleep physiology or sleep medicine in our training. And also there is a relatively little attention to sleep in public health and primary care. And again, poor sleep may also contribute to health disparities. So in terms of simple advice, which we can provide to our patients or the general public to improve sleep habits or sleep hygiene. So you see that there are many organizations around the world providing, very basic recommendations. These are a set of recommendations from the CDC and the American Academy of Sleep Medicine. Be consistent with your sleep timing, go to bed at the same time each night, get up at the same time each morning, including on weekends. Make sure your bedroom is quiet, dark, relaxing, comfortable temperature. Remove electronic devices such as TV, computers, smartphones from the bedroom. We show the evidence linking use of electronic devices on poor sleep quality and potential risk of disease. Avoid large meals, caffeine, alcohol before bedtime. Get some exercise. Being physically active during the day can help you fall asleep more easily at night. Again, we should try to avoid, however, vigorous exercise around the bedtime period. If sleep problems persist, then it's recommended to consult a medical professional sleep specialist to rule out underlying conditions. And if you are interested, there is a wider list of recommendations from the same organizations. Obviously, in primary care, we often deal with the people with multimorbidity. So again, we need also to rule out potential underlying conditions which may have an impact on sleep habits. And also, we need to look also at the medications, especially for people on polypharmacy, dealing with multimorbidity. For example, some antidepressant medications can lead to insomnia. In terms of public health campaigns, I feel in US there is a stronger emphasis than in Canada, and I'm not sure about other countries, but certainly being part also of I'm part of the Sleep Health Journal, the American Sleep National Foundation. I see there is an increasing emphasis also in terms of public health campaigns in US on the importance of fostering good sleep habits in the general public. I don't think in Canada sleep is still perceived to be a major priority in terms of public health campaigns. So I hope we can do some advocacy work to incorporate sleep also among our public health priorities. So just to conclude my talk, primary care takeaways, I will say that the short questionnaire to assess sleep duration, quality, satisfaction may be a useful screening tool to detect sleep problems at the very early stage. When we deal with the people who may suggest, poor sleep, we can provide simple tips to improve sleep habits, as well as promote, generally speaking, healthier lifestyles in terms of dietary patterns, physical activity, and so on. But if sleep problems persist among our patients, then I think we should investigate potential underlying conditions and even consulting a sleep specialist. In general, I think there is a need for a paradigm shift. We have focused on sleep disorder and clinical diagnosis. We need to move now to promote sleep health. So we need to incorporate sleep as part of the lifestyle management, also for both disease prevention and clinical management. So I want to just acknowledge different study populations for the research we have done, and a long list of colleagues here at Western who have been part of these research. I think I'm done, Jane.
Wonderful. Thank you so much, Saverio. It was perfect. And I really like the clinical implications of the research that you've done in the past as well. So, and that's ongoing, right? So there's a whole public health policy or mandate for us to consider, but it really does trickle down to the to that aspect of clinical implications and what physicians can also do to give practical tips and advice to their patients. So thank you for that. If you want to stop your screen, you can, and then we can just go through some questions. Perfect. So we've got a couple of good questions to start us off on this discussion. And so I'll start with Carlos Semprin first. He's asking if there's any recommendations for patients with sleep problems, shift work, and alcohol abuse. So he said, I've found some patients relying on alcohol use as a sleeping aid, but unsure how to address the effects of shift work on sleep patterns. Thanks again.
Yeah, that's a great question. Also, I will say complicated one, and obviously our colleague has basically raised the issue of the interrelationships between different lifestyles. Obviously, it is correct that shift workers may use addictions, including alcohol, as a coping mechanism, right? And so it's very difficult. So those are very difficult scenarios. Again, I think there are obviously, I'm not sure, is this colleague based in Canada or in another country? Carlos.
Yeah, I'm not sure where he's based out of, but Carlos, maybe you can let us know. It's hard for them, I think, to insert that after they've asked the questions, just because the chat function is disabled, I believe.
Yeah, because obviously, there are centers where people with addictions can be referred to, and so I think if the primary care physician detects addictive behaviors, I think that person should be referred to a specialist in order to get some support, because obviously the excess drinking behaviors will further impair the sleep habits of that individual who is already exposed to a potential circadian rhythm misalignment just because of the shift work schedule, and alcohol will not help. So I will certainly recommend to address the addictive behaviors, and try also to make perhaps recommendations on changing the working schedule, because seems to me those are very extreme conditions where I think a primary care doctor can make recommendations in terms of changing the working routine if that is a possibility within that specific workplace.
Excellent. That's great. And he did respond to say that he is based in Canada. So thank you for that question. Excellent. So our next question is that given the inter-individual variable half-life of caffeine and its ubiquitous use in general public, as well as athletes for training and as an ergogenic aid, can you comment on the effects of caffeine on sleep onset or quality? Or do you have any recommendations on caffeine timing relative to sleep?
Yeah, usually if you look at these broad recommendations, I recommend that people should refrain from drinking coffee no later than early afternoon. Obviously, there is a lot of inter-individual variability. I'm Italian, and Jane, you are half Italian, and you know that in Italy, people drink coffee after dinner, right? I don't, because I've become more Canadian. So I stopped drinking my coffee at 2 p.m. That would be the latest. So there is a lot also inter-individual variability, right? But in terms of the general recommendations, try to avoid any kind of substance which will have an impact on the sleep-wake cycle, or will stimulate the neurovegetative system. So the general recommendation is trying to avoid use of caffeine late afternoon, certainly in the evenings. But having said that, there are people who do well even drinking coffee later in the day. So it is always multifactorial, right? Because obviously there are, as we have shown, there are so many different influences. And sometimes it's, as you know, it's very difficult to provide, general recommendations without considering the individual profile of people, just in terms of behaviors. And so some people will be okay even drinking coffee later in the day, but it seems that we should refrain from drinking coffee from late afternoon and certainly in the evening.
I think it's an excellent point. And Ryan, thanks for the question as well. Certainly when we work with athletes, there used to be recommendations in terms of the maximum amount of caffeine that you can ingest prior to getting a positive doping test, for example. And that's changed. Those restrictions have been lifted, but certainly that balance between trying to provide some positive performance enhancement, especially for those whose competitions may be later in the day, but then the resultant effect on sleep, I think it is one of those things. And I really appreciate your answer on that, Saverio, that it's probably individual to some extent as well. Yeah. And as I often say to athletes is that to try something, test something out in training before you do it in competition. I know that's not a new idea, but certainly can be helpful to athletes to test out our individual variations on that, for sure. We have a third question from Dr. Jessica Page. Welcome, Jess. How long does the effect of reduced sleep persist in increasing injury rates in athletes? So she's asking specifically about elite athletes traveling the world for competitions to multiple time zones regularly. Does a good night's sleep solve the issue, or is there a lagging harmful effect?
Yeah, I don't think we have that granular data in the available evidence. To my knowledge, is not necessarily my field of expertise, as you know, Jane. But I will say that both acute sleep deprivation and sustained sleep deprivation, obviously, based at least on my knowledge, will increase the risk of injuries, and obviously among athletes, I guess that acute sleep deprivation is more likely to happen. But you have been an athlete. I'm just an amateur, so you will know better than I do in terms of, I'm not sure what is the, for example, prevalence of sleep deprivation among athletes, and I don't know if we have any epidemiological data on that. But especially for those international travelers, obviously, I assume there would be a lot of acute sleep deprivation, and that seems to increase the risk of injuries as well. So it seems that it's both acute, short-term, and obviously sustained chronic sleep deprivation, which seems to increase the risk of injuries, but also of musculoskeletal pain. Mm-hmm. I don't know if you have any personal experience yourself to share.
Yeah, in terms of, well, not necessarily personal experience, but I mean, certainly on the effects of sleep and time and jet lag, perhaps. But the issues around injury prevention, from my understanding, what we know of the research is that it's pretty consistent with general population. In some cases, elite athlete populations have even more sleep disturbance, and it can depend on in and around competition time versus training. So I think it is one of those hot topic issues within sport and exercise medicine, certainly, and that I think our better level of evidence is more in pediatric athletes, but in the sense of really a lack of sleep, almost doubling injury risk. Great question, Jess, and I think it's a point well taken that there's probably research to be done in that area in terms of the chronicity of sleep deprivation and its effects, if it's acute or long-term in terms of injury risk. And that kind of coupled with one of along the same lines as a question I had for you, Saverio, and I'm seeing that there's another question from a guest. So one of those just aspects, and this is again anecdotally what we've been told as athletes before as well, is that if you're preparing for a race, and this would be as a clinician, I'm thinking to discuss with my own athletes, patients, students prepping for an exam, a stressful event is coming up. Night before a stressful event, if it's an exam, if it's a race, if it's a big talk, if it's whatever the case may be, that sleep, sometimes people can lose some sleep just because of thinking, anxiety, all those kinds of issues, right? Or even anticipation, excitement. We were always told that as long as you get a good night's sleep 2 nights before, you're good. It will carry over if the night before. Now, that might have just been some positive psychology, but I think it does speak to the effects of, we don't really know, I guess, the acuteness of once these problems come on, right? Whether or not this is a chronic problem. Maybe if you could just speak to, if you know of any of the scales, do you know if it's like usually do they measure kind of the last month, how you've been sleeping, or the last week, or if you had any thoughts of those kinds of measurement tools?
You mean in the general research, right? And that's the question you have, or yeah. So that's an important point, because that was one of the limitations we have in many of our studies, is that we often rely on measure of sleep and also other behaviors in the most recent past, like in the last week or in the last month. But as we know, I mean, in chronic disease, epidemiology is very important to assess fluctuations over the lifespan, especially when we try to assess the risk of chronic disease, which should not develop from one day to another. So I think it's important to improve our methodology to assess sleep habits, over the lifespan, and some studies are trying to do that. As far as self-reported information, if you're talking about athletes in particular, I don't think there is a lot of evidence on trying to assess sleep, over the long period. It's always, mostly in acute settings, right? And again, you will know the literature perhaps better than I do. And you were mentioning about pediatric populations where sleep deprivation will increase the risk of injury. That sleep deprivation is an acute sleep deprivation, is a chronic sleep. Do you know?
Right, I don't know. I'd have to look back at it. Maybe one of our guests would know as well. But yeah, certainly, yeah.
So I think there are biological mechanisms to justify the impact of both short sleep duration in terms of hormonal responses, and we talk about a dysregulation of the appetite, for example, leptin, ghrelin. We know about responses in terms of stress hormones like cortisol, responses in terms even of blood pressure responses, because obviously if you have sleep deprivation, the physiological dip of blood pressure overnight will not happen, and then you need to look at the more sustained long-term implication of sleep problems with, for example, systemic inflammation, because there is quite a large body of evidence showing that sustained chronic sleep may increase systemic inflammation. And we know that systemic inflammation may cause all kinds of chronic disease, or also the risk of injuries or musculoskeletal pain. So yeah, it's a very complex issue where I think we need to look at both short-term and long-term implications, but the biological mechanism are there is evidence on biological mechanism which is quite solid.
That's fantastic. And I think we'll leave it there, because we're just at the hour and we want to respect everyone's time. So thank you for tuning in. I do really like that emphasis. It's not just about injury, but also about the increase in pain. So something for us as clinicians to think about as well. Angela, thank you for your question. We will, I think we should invite Dr. Stranges back to deal with this one. It was more about medication in terms of the evidence about zopiclone causing cognitive decline and dementia. For the purposes of this talk, we were not going to dive into medications, but it's a valid point and a valid question. I think we could probably spend a whole lecture on that. So we'll have to invite you back. And I just really wanted to thank you for providing a very extensive overview about the effects of sleep and physical activity, the complex clustering that is going on in terms of some of these behavioral modifications that we can counsel our patients on, and the real practical clinical take-home messages that we can have. And also want to thank you and congratulate you for what an immense body of work in the literature and research on this very critical topic. So thanks everyone for joining in. We will Oh, there is a question about being involved in our research projects. So we'll have to table that for a future session. Thank you again for those questions. Please tune in. The next masterclass is on March 30th with Dr. Ninette Murtry on walking and health. And we really look forward to seeing you there. Please let us know through the evaluations what other topics you want to hear about. So for example, those that weren't addressed today's lecture. And thank you for joining. You're going to be sent that link to participant evaluations, and then you can get your certificate of participation there. And certainly please email us with any questions or concerns. Thanks everyone. Have a great day, and see you soon.